Good morning, everyone, to the Thursday, August 25th Public Health Virtual Media Briefing. Today we have Dr. Shankar Nazathuri and CEO Nicole Dupuy of the Windsor-Essex County Health Unit, and they're going to take questions from the media. We'll jump right into questions, and we'll start with CBC.
Yes, good morning. I'm wondering if you can tell me a bit more about your new partnership with the university, what that entails, and what sorts of initiatives that we can expect to come out of it.
Thanks for the question. I wish I could provide specific details about the partnership. Really, our announcement was just about, announcing that we are embarking upon this partnership, and it would include, of course, considering the relocation of our services at 1005 Alette Avenue, so our Windsor location, over to the campus of the University of Windsor. We're just kickstarting that partnership now, and so there's lots of things that we'll be working on collectively between ourselves and the university now that we've sort of officially announced this partnership that will provide more details on some of those strategic alignments that we hope to see. So things like research initiatives, student opportunities. So their possibilities, I think, are broad, but I wouldn't be able to provide any specific details. Those are the things that we hope to work out over the next few months, and we'll share, as we go along.
Okay, and the moving of the health unit's headquarters, that would be something that would happen in the short term, right? You guys are looking for a new home in the next little while, right?
Yes, for us it seems long, but yeah, I guess in the life of a move, it's short. But yeah, our original timeline for moving that we were shooting for was the beginning of 2024, so that's still our target. But obviously, we'll be working closely with the university to determine what that exact move date will be, and we'll certainly again share once these items have been more solidified and approved by both our boards, then we'll be able to bring all that information to the public and certainly our staff.
Thanks very much.
Any questions from AM 800?
Good morning. I'm not sure who this one is for, but I know we've talked about the opioid crisis a number of times during these briefings. And earlier this week, there was that report that came out about nearly 2,800 people in Ontario between April 2021 and this past March passed away. Just wondering if we have any updated stats for Windsor-Essex during that time frame.
We do. Just to confirm, there's been a approximately 40% increase in the number of opioid deaths when we compare the post-pandemic period to the pre-pandemic period. If you send us an email, we'll give you the exact numbers that we know that happened in the last 2-year period, and then we can give you a comparator number from before. About 60 to 70 people die of opioids in Windsor-Essex on an annual basis, and there are many more people who die of opioids province-wide than people who die in car crashes. I don't think at the Windsor-Essex Health District we can say that the first year of the pandemic was that much different than the second year of the pandemic. There's always some variability in the number of deaths attributed to opioids, but I do feel comfortable sharing that the number of opioid deaths in Windsor-Essex after the pandemic began is more than before the pandemic, and we estimate that it's approximately a 40% increase.
Doctor, I know you've talked about this a number of times, but and then with all the alerts that have been sent out, obviously there is a crisis here in Windsor-Essex, and I know there's education going on. There's working with the faith-based organizations and health organizations. But once again, your message to the community in regards to the opioid crisis in Windsor-Essex.
Well, there's an immediate issue and a longer-term issue. The immediate issue is that we want to keep people alive while they're currently using opioids. We want to do that without judgment. And we know that I think it's about 60% of the people in the community, a good number of people who die of opioid use overdoses die at a private residence. I think that if you have any thought, inkling, suspicion that someone in your household or someone that you know might be using opioids, get an naloxone kit. It can save a life. So that's sort of the immediate issue. The second is a more long-term issue, and it is a complicated one. I think people who are using opioids and want to get help should get timely access to treatment, and I think that's an important goal. I also think that some, but not all people with opioid use challenges have underlying mental health and psychiatric illness, and it's incumbent on us to provide timely access to mental health services to try to mitigate or manage the burden of mental illness in this community and the community overall.
Thank you.
Any questions from Blackburn News?
Yes, Nicole, I wanted to ask you what changes are going to be needed in Residence Hall West at the university for the health unit to move in there. I understand that it was a residence before for students, so obviously a lot of work is going to need to be done. But what would you like to see there?
Yeah, you're correct. A lot of work will need to be done to bring it, to convert it from a residence to an office space and clinical space. We have already been in discussions, of course, with the university. One of the big pieces is exploring whether or not there would, it was feasible to support our services and the types of uses that we require. And, we feel confident that that is not a question. I can't really provide, the details, but obviously the clinical spaces are probably the largest conversion that'll happen. So adding in, our dental spaces and a number of operatories as well as our clinical services. So without providing the details yet, because I think those are items that we're still working on and we'll be able to provide in the future, I can say there is, quite a bit of work that'll need to go in over the next, year or so before our move to bring it, convert it from a dormitory into, an office. But we feel confident that it's a great location and it will definitely meet the needs of our staff and our clients.
Is it bigger?
It is, yeah. So one of the pieces of our relocation was looking at our space needs assessment. I think I've communicated this before, but this was a longer journey. I know we had embarked upon this, as far back as 2017, and we had done a space needs assessment, and we revised that assessment when we undertook this process again, and looked at what might be, what do we need now given the expansion of our services, especially as I said, our dental services have grown quite significantly, as well. Trying to the best we can project any potential changes in our staffing levels over the next so many years in future. So it is bigger. One of the key pieces about us moving out of our current space is that it is not large enough to house the number of people we have, and it's not large enough for the services that we provide out of our building either.
This next question is for Dr. Nessa-Thury. In the past 2 weeks, Windsor police have interacted with people who had severe mental illness and had weapons. One resulted in a shooting death. I wanted to ask you your thoughts from a public health perspective. Yesterday, the acting police chief mentioned that, what we've got going on now in regards to this just isn't working. I wanted to get your thoughts on it from a public health perspective.
People, there is a real unmet need for people who have psychiatric and mental health needs. And I've written about this previously, or I shared my perspective on this previously in the Ontario Medical Review. I think we face a real challenge, and I would say it's a crisis, to be quite honest. There's a crisis in access for mental health services in this province. But crisis is particularly significant for children and perhaps for people that are disadvantaged and otherwise marginalized. And I think that we as a society, as a culture, as a province, have to improve access for services, but for both physician services such as psychiatrists and non-physician services such as psychologists and social workers and other clinicians or other clinical staff that can help people who have mental health issues. That includes in the acute phase of mental illness, as well as in the chronic phase of mental illness. There's an overlap between substance use and people with substance use challenges and mental health challenges that requires particular attention. I think access to health services overall has been further challenged by the pandemic, in part because of clinical services for COVID crowding out services that might be provided for other people. And also there have been human resources challenges and people potentially, or staff are potentially disqualified from working because they have COVID. So sorry for that long-winded response, but I do think that we clearly have a crisis in access. Access is one part of providing a meaningful and functional health system. The other two parts, or the other two key components, are patient satisfaction and quality of care. And it's something that warrants attention by the public overall.
Thank you very much.
Okay, we'll take another round of questions and we'll go with CBC.
Yes, I know I asked about this last week, but is there any update on the student vaccination numbers? Also, if you could say what types of vaccines are required in your response and what the deadline is, that would be fantastic.
Well, the vaccine verification process is part of the Immunization for School Pupils Act. The Immunization for School Pupils Act is a progressive piece of legislation. One of the goals of vaccine verification is to make sure that young people are vaccinated and up to date on their vaccines in schools, and ultimately prepare them for adulthood. If you send us an email, we will enumerate all the vaccines that are required, or maybe Nicole can enumerate them because there's some that are required and some are not.
Well, I think what you're looking for is the number of outstanding potential suspensions, if I'm correct.
Sorry, I actually loaded a couple of different questions in there. Yeah, what the update is on suspensions, and also if you could say which types of vaccines are required and the deadline.
Okay, go ahead, Shank. Sorry.
So just because it's a very technical question, send us an email and we'll enumerate the ones that are required under the statute and the ones that are not. We try to get people up to date on all their vaccines as they enter adulthood. The number of people whose records are not up to date is declining. And we can give you the most up-to-date number in an email today as well. So if you email us that number, we can definitely get to that point. We think that people are availing themselves to the opportunities to get vaccinated, and people are sending in their records. And so as we get closer to September, when young people may be subject to suspension, I hope that number comes down to the smallest possible number of people that might be subject to suspension in September.
Thank you. I'll follow up by email.
Sorry, I can add, it's not exact, but the most recent number we have right now, Dr. Nasseri is correct. We have had quite a decline. As I reported last week, our team is working really, really hard. Our appointments for vaccination catch-up are all booked, and we're adding more to, just accommodate the community. And so, we are seeing people come out and update their records, and then those who are missing vaccinations are coming out and receiving those vaccinations. And just again, to remind you that it is just secondary at this point. But right now we're at approximately still around 5,000 students, much lower than where we started. And so we are, I think for the previous week, we saw about 1,000 come off the list and another, around 900. So we really are getting that decline, and we're very, very positive that by the time we get to that suspension date, we should be close, if not at zero. So we can continue to give updates, but that was the update as of yesterday. We were at approximately 5,000.
Thank you. And is the suspension date, is that at the end of the month or does that coincide with the start of school?
It's still, I have to get the exact date. It's in mid-September. So it's not the very beginning of school. And as I mentioned, I think last week, we will be, having a lot of clinics up until the first day of school, as well as targeting neighborhoods and areas, going out into the community that first week of school just to accommodate and make it vaccination more accessible. And we'll continue to offer clinics right up until the day of suspension as well as afterwards. But it's mid-September is the date.
Thanks very much.
Yeah, if I could just share, because this is such an important issue. Some people are not up to date on their records, meaning that the children in their household or the young people are completely vaccinated, but the records are not updated. And when people send records, we update the public health record, the public health files. There are other people who are missing certain vaccines. They have a number of opportunities to get up to date, and that includes clinics sponsored or facilitated by the Public Health Service, but it also includes family physicians' offices. And we want both of those items to come up to speed. Also, there's a fairness issue and a justice issue to the extent that kids who go off to college and university may have an opportunity to have vaccine verification again, because certain schools require people to be up to date on their vaccine on enrollment or when they go to the dormitory. But for young people who don't go to college or university, this may be the last time that they have a formal vaccine verification. And so we want all young people, including those who go to colleges and universities, to be up to date. And this is our chance in Ontario to make sure that young people do get vaccinated before they graduate or leave high school. The pandemic has affected our vaccination programs because we weren't in schools to vaccinate against certain illnesses. We're working full speed ahead to try to provide that service so that we can get caught up on vaccine. One vaccine that's not included in the Immunization for School Pupils Act, but is particularly important, is the HPV vaccine. The HPV vaccine, the vaccine that prevents cervical cancer, among other cancers, including penile cancer and anal cancers. And we need to get that vaccination rate up. I think, and we can give you an exact number, but I think the estimate was there were approximately 200 people who died of cervical cancer in the province in recent years. And if we can get the vaccination rate up, we can make a big difference in preventing cervical cancers in the future. My apologies for that long-winded response, but we do appreciate that question.
Thanks very much.
Any follow-up questions from AIM 800?
Doctor, just in regards to the COVID vaccine, I know last week a couple of us asked you about where we stood, and I know the stats don't get updated till noon here, but has there been a jump since last week after you made the call and said you were concerned where our numbers were?
Well, I don't have the, well, we can get the exact numbers at noon when they're released. I am concerned, and I remain concerned that our overall vaccine coverage rate for COVID is low. The burden of COVID today compared to the last time we met, the last time we all spoke, is about the same. But I'm more worried about what the fall is going to bring with the introduction of the flu and other respiratory illnesses, and people spending more time indoors. And so I still remain concerned about the burden of COVID moving forward, and I am concerned about the low level or the low levels of people that have been up to date on their COVID vaccine.
Thank you. Just a quick one for Nicole. Nicole, I see on the website and on social media the health unit hosting the clinics. We've been asking this question during all these briefings, but what's the response been like? I know it takes a toll on you and the team to host these. Are you seeing that response from the community? Are people still coming out to these pop-up clinics?
We have lots of clinics going, Rob. I assume you're meaning our COVID vaccination clinics.
Yes.
Okay. Yeah, I mean, I think I couldn't say more than Dr. Nesathuri said. We are still seeing people book appointments, but we're not seeing the uptake that we would hope, knowing the number of people that are eligible. Certainly, the number of people that are eligible for any vaccination right now, we'd like to see everyone come out and be, as we said, up to date. And so we're definitely far off that goal. It is a lot of effort, but we also have our school immunization clinic going at the same time, and those are happening in concert. So, yeah, so the team is busy, but for the COVID vaccination, we definitely would like to see, more interest and more uptake for sure.
Thank you.
Any additional questions from Blackburn?
Just one remaining question for Dr. Shanker. I wanted to ask you this before, but of course we had to move on. I wanted to ask you if we have a shortage of psychiatrists, psychologists, and psychiatric nurses in this province. We hear a lot about the nursing shortage, but you mentioned that psychiatry is experiencing a crisis right now. So would you characterize it as staffing shortage, or what is the cause of it?
So this is not the official position of the Public Health Service with me as a doctor and 30 years of practice. One issue perhaps is the regional distribution or the allocation of the psychiatrist. And we know that specialist physicians, including psychiatrists, are more concentrated in larger urban centers. Secondly, I think that we need to think of what services are provided by physician clinicians or psychiatric clinicians, and are they being provided to the most important or most prioritized populations of people? I think that we have to think about how we expand access to non-physician services. OHIP pays for the psychiatrist. It's funding, the funding for non-physician clinicians is not as robust, and I think that's an area of opportunity. I also think that we have to think of this as people with mental health are stigmatized or marginalized sometimes, and I think we need to talk about that more boldly. We need more provincial action on access to mental health services and psychiatric services.
Thank you very much.
Many people.
Oh, sorry, go ahead.
Yeah. This is a really, if I'm going to speak more freely on this, this is a really important issue to all of us. I would hazard to say that if you went to the hospital, a teaching hospital, and you had cardiovascular disease or pulmonary disease, you had a heart attack or you had chronic obstructive pulmonary disease, that we would expect to be seen by a cardiologist or a respiratory medicine specialist or a pulmonologist. If you went to the ICU, we would expect us to have access to a specialist physician and a specialist team in intensive care medicine. Many people have serious psychiatric illness and they can't get in to see a psychiatrist. Many children have serious mental health issues and they can't get in to see a child psychiatrist. The waiting lists are completely unacceptable in some cases. And so I think that, you asked the question boldly, the response is bold. We need action on this item, because without access, patients can't get care. And the heart of Medicare, the fundamental goal of Medicare, is to provide people access to important and vital medical services. And I think that this has been something that's been ignored for a long time, and it needs to be addressed immediately. And I hope that you'll ask in the media these questions of people in other decision-making roles related to access to mental health services.
I will. Thank you.
Are there any questions from CTV?
Yep, sorry, second week in a row, a little late. Just wondering, I don't know if you've heard about the former city workers that are launching a lawsuit over the COVID-19 mandates. So apparently they were let go. So they argue that the vaccine is no longer a condition of employment. So just curious, as the health officer, do you think it should be? Maybe your thoughts on the idea of, the lawsuit being launched?
I'm not a lawyer, so I can't comment on the legal framework for this, but I can comment as a public health official.
Okay.
Requiring people to be vaccinated, or encourage, first of all, we always want to try to encourage people to do what we think for things that are best for their health, and not only for their health, but for the health of others. So the first part of vaccine and vaccine programs is to help the person who get vaccinated. And many vaccines help the person who is getting vaccinated. If you're vaccinated against polio, you're not likely to get polio. If you're vaccinated against tetanus, you're protected against tetanus. But for certain infectious diseases, getting vaccinated also means that you're helping somebody else, that you're not becoming part of the chain of transmission. So you may get a disease, and if you're unvaccinated, or you may get a disease that you might transmit to somebody else. So by getting vaccinated, you're also helping somebody else. As a public health policy matter, some people's jobs in public service are so important that we can't have individuals or a group of them get sick. And in that particular case, the public policy has to weigh the rights of the individual or the preferences of the individual versus the collective benefit of keeping a vital service running. So the example I would give is we need to have the water service. We need to have the water authority functioning 24/7 all the time. We can't live without safe water. And so there are certain things that we might require of people who work in the water service that we might not require for people in other occupations as it relates to vaccination. I think it's a fair thing to require it for certain individuals. So that would be my contextual argument. I would always encourage people to be up to date on their vaccines, and people who serve in vital public roles, I think that's particularly important.
Okay. Well, I guess just further to that, so with vaccination no longer required, should they be allowed back? Should restrictions be there still for them, that sort of thing?
Well,
moving into the fall?
Well, that's a legal question, but as a public health question, I would encourage people to be up to date on their vaccines. People who work in public service have, from my estimation, a certain level of responsibility to the public overall, people in the police service, the fire service, and I think it's incumbent on them to be up to date.
Okay. Thank you.
Thank you, everyone. Our next virtual media briefing will be on Thursday, September 1st at 8:30 a.m. And we will send you the link when this recording is uploaded to YouTube. Have yourselves a great day.
Thank you. You too.
Thank you, you too.
Thank you. Bye-bye.
Thanks so much.
Cheers.
Bye-bye.